Knock, knock, knock. Hi, my name is Shannon, sanitizing my hands as I walk into the patient's room. Hi, my name is Shannon. I'll be your nurse today. May I have your name and date of birth?
Tina Jones, June 5th, 2000.
And Tina, what brings you to the hospital? What brings you here today?
Have a sore tailbone.
Oh, okay. I'm sorry to hear that. And may I ask Tina, how did you get here today?
I drove myself.
Okay. And do you know where you're at?
I'm at Christ Hospital.
Okay. And on a scale from 0 to 10, what would you say that tailbone pain is?
A good 4 and very dull.
Okay. Well, I'm going to do a head to toe assessment. Patient is conscious and coherent, time 4. So how long have this tailbone been happening?
Since yesterday.
Okay. And so I'm going to do a head to toe assessment, and once I finish that, then I'm going to give the information to the doctor, and then he'll be back in, okay? So I'm going to, let me see. Oh, can you tell me of any issues that I need to know, like any family history, medical history?
Nope.
And you said this pain started yesterday. Okay, and you said it's it's between a 3 and a 4 is your pain level, and you brought yourself here today, and you know where you're at, and any past surgeries or anything that I need to know about? Any current medications that you're on?
Nope.
Okay, awesome. Well, I'm going to start the head to toe assessment. I'm going to start at the head. Hair is equally distributed. I would have on gloves when I am doing this. Hair is equally distributed. Have you had any issues with any hair loss?
No.
Okay. All right. Now I'm going to check your I'm going to shine my light in your eyes. So I'm going to check your cardinal fields, okay? All right. So I need you to look straight at me. Okay, and eyes are, okay, and then I need you to look at the tip of my pen and do not move your head. Okay, pupils are equal, round, and reactive to light with accommodations. All right, now I'm going to check your ears. Have you been having any issues with your ears?
No.
Okay. All right, ears show no signs of redness or drainage. Okay, and now I'm going to, if you tilt your head back, I'm going to check your nose. Okay, nose is clear, no drainage, no crusting. Open your mouth for me. Stick out your tongue. Say ah.
Ah.
Okay. Inside of the mouth is moist. Uvula is in the mid, centered properly in proportion. You can close your mouth. Teeth are evenly distributed. Mouth is moist. No redness in there. If you can turn your head to the left for me, there's no jugular distinction. I'm going to give you this glass of water. Drink that for me. Do you have any issues with swallowing? Any pain? When was the last time that you had an eye exam?
Last year.
Okay. And do you wear glasses or contacts?
Yes.
Okay. And if you can lift up your eyebrows for me. All right. And if you could puff out your cheeks. And if you can open your mouth, close. All right. Did you experience any pain when you did any of that? When was your last dental appointment?
It was last year as well.
Okay. Awesome. All right. So I'm going to ask you to, I'm going to check your see if you have any issues with any pain in your head. So if you push up against my hand, and this way, and front, and back. Did you experience any pain when doing that?
Nope.
Okay, and if you could shrug your shoulders for me, up. Okay, forward, and back. Did you experience any pain?
Nope.
Okay, now I'm going to ask you to hold your arms up like this for me, and push against, and back. Did you experience any pain with that?
Nope.
Okay, now I'm going to check, hold your hands out for me. I'm going to check your capillary refill is less than 2 seconds. Squeeze my fingers. All right. Did you experience any pain with doing that?
Nope.
Okay, awesome. Now I would also get a set of vitals. Blood pressure would be 120/80. Heart rate would be normal. I would check blood pressure, heart rate, radial pulse. I would also check, let me check your radial pulse. Hold your arms down. And it is +2 bilaterally. Also, I would check temperature. Would get his temperature with a thermometer, electronic thermometer, and let me see, blood pressure, heart rate. Oh, and I would also check O2 saturation, which with normal range is 99% on room air. All right, so I'm gonna ask you to slide back for me, and then I'm going to listen to the 4 areas of the abdominal. So when was your last bowel movement?
Last night.
All right, do you have any issues with going to the restroom?
Nope.
Okay. Oh, sit up for me. I'm gonna check your heart and stuff first. I'm sorry. I was like, I'm missing something. All right, so I'm gonna check. I would check the heart. 8 in the front. 8 in the front. Anterior. 10 in the back. Posterior. The heart and the lungs. And in a normal situation, my stethoscope would be on bare skin. So it's aortic, pulmonic, herbs, mitral, and tricuspid. And then I would listen to that was the heart. Then I would listen to the lungs. 1, 2, 3, 4, 5, 6, 7, and 8. And then I would do 10 in the back. Lung signs are clear. On normal breathing. On the back, I would just breathe regular for me. And I would normally ask the patient to breathe in and out, take deep breaths when I was doing that. And on the back, I would do 10 places. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And lungs are clear. Then I would ask you to lay down. We would listen to the bowel signs. And if you get from your medium point, I would assess this would be on bare skin as well. I would assess the patient. No distinction. There's no abnormalities. Skin is intact, appropriate for race. I would check the 4 quadrants, starting with the lower right quadrant. 1, 2, 3, and 4. Now I would inspect, then I would listen. I will auscultate before I palpate. So I've auscultated all 4 quadrants. There's no abnormalities, no abnormal sounds. Then I would palpate and also assess for pain. Do you feel any pain or tenderness?
No.
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 In all 4 quadrants. All right, you may sit up. Okay, and then I would also check the patient. I would also check the patient's, which I forgot to do earlier. If you hold your arm out, skin is warm and moist. There is no skin turgor. I already did the capillary refill. Hair is evenly distributed, and skin is appropriate color for race. And I would do the same for the toes. I would check the capillary refills. Push up for me, push down. Did you experience it? Push out and push in. Did you experience any pain with doing that?
No.
I would also check the upper part of the legs for skin is warm, moist, and dry. I would pinch the skin to see if there's any skin turgor. Capillary refills is less than 2 seconds. There's no skin turgor, no indentions. Let me see what else. Patient did not experience any pain when I checked his reflex. Oh, I would also sit back for me. Just sit back. You don't have to lay down. I would also check, after I check the capillary refills in all 10 toes, I would also inspect the heels of my patient, and I would check the posterior medial pulse and the tibial pulse as well. And it is evenly bilaterally. And I think that is about it. So, do you have any questions for me?
No.
Okay, well, thank you so much for letting me do your assessment. I'm going to enter all this information, Tina, into the computer, and then once I do that, into your medical records, and then the doctor will be in to look at all the information that I put in here. Okay? Thank you so much for letting me do your examination. I will sanitize my hands on the way out and provide patient privacy. When I come in and when I go out, I will provide patient privacy and always sanitize my hands coming in and going out. Thank you.